Well, I'm sure you've heard a little bit about massage cupping. If you've watched the Olympics in 2016, you probably saw some of the perfectly circular marks on the back of Michael Phelps, the star swimmer's back and shoulders. Probably wondering, how did he get those bruises? Well, you know what? They're not bruises at all. Those are the result of bringing blood flow to the surface from an ancient method that goes back 1500 years BC to the time of the ancient Egyptians and the Asian peoples. They used different types of instruments to achieve a suction effect on the skin, bringing in what they called energy back in the day. We now know it's blood flow to the surface. We're going to take a look at some of these massage cupping tools that you might be able to use in your practice or to use at home for your own self-massage and release of tension. So take a look at some of the cups we have here. There are a variety of cupping tools available. These are just some of the few that I have in my office. In ancient times, they were made out of bamboo or earthenware. There were different types of cups used, and they wanted to achieve a suction by putting a flammable liquid on. Back in the day, they used plants. Here we have a cotton ball, putting a flammable liquid on a cotton ball. So here we use some oil. I like coconut oil or olive oil. And as that burns, you see it comes on fire. We're not going to burn the patient, but the fire goes out when you attach it to the skin. So it creates a suction vacuum effect, pulling the skin up into the cup. So that's something that you can use the ancient ways for, plus the effect of the heat on the skin is also very nice. In today's world, people get a little nervous when you start bringing flaming goldfish bowls at them. So we're going to take a look at the more new versions of doing these that are very sanitary and very safe. There are silicone massage suction cups of all different sizes, and the size is at the opening of the cup here. I really like this style. This has a nice rounded edge, so it's very smooth and comfortable on the skin. Not scratchy. I've seen some suction cups that had sharp edges, very uncomfortable on the skin. But you see how it could pull and lift? You squeeze the cup to take out the air. As you place the cup on the body, the suction effect pulls the skin and the blood to the surface. So there's bringing in blood flow. In physical therapy and massage therapy, generally in medicine, we like to increase blood flow to an area to help with the healing. Originally, the cups were typically placed in one spot and left there for several minutes at a time. Now, since this is applying a suction or vacuum effect, if you left it there for quite a while, you'll see quite a bit of blood flow. Leaving it longer, it might actually start to develop petechiae, or the purple marks that most people consider is a bruise or a black and blue mark. It's not a bruise, it's just bringing blood flow to the surface. If you apply too much suction and you leave it over time, it brings so much blood flow to the surface that sometimes the superficial blood vessels may break, leaving you a black and blue appearance of a mark. But it is not an injury, it is not a bruise. It's blood flow brought to the surface through the suction vacuum effect of using the massage cupping tools. So we'll take a look at some of the variety of tools here on the table. The older ones were different sizes of what I call goldfish bowls. These are typically used by acupuncturists. It's a very thick glassware with a nice thick lip so that it glides nicely on the skin, no sharp edges. If you do choose to use glass instruments, I'd highly recommend to make sure and inspect them each time that there are no chips, because you can slice the skin very easily and you certainly do not wish to do any harm to a patient. So check each of your instruments is in excellent condition. One of the benefits of the glass bowls too is that it is very sanitary. You can wash them, sterilize them. I wash my equipment in Clorox-based water, so it's a multiple antimicrobial and very easy to wash, dry, and reuse again. On the downside, of course, it is glass. If you drop it on a hard floor, well, it's very likely to shatter. These are fairly heavy, and I've dropped them a couple times on a rug, and it hasn't shattered yet. But always inspect your tools before using them to make sure everything is intact. Larger areas of the body, like the back, you might want to use a wider opening in the suction cup. Medium-sized areas, you want to get a smaller area that's a smaller hole opening. And then if you're working on a very small area, such as the palm of the foot, the palm of the hand, sole of the foot, you could use a smaller suction cup. So those are very lovely and they're easy to hold. Going back to my favorites, the silicones, there's different sizes. I'm only showing 2 sizes here. When they're used for a while, they become very soft and gel-like and easy to manipulate. When they're brand new, as this one, more stiff. So you need to work it in a little bit, and once they warm up, also being silicone, they become more soft when they're touching the skin. So I make sure I keep them out of the cold areas like the windowsills because I don't want them so stiff. I want to be able to keep them flexible, pliable, easy for me to use and apply on a patient. There are suction kits that you can get, and they come with these suction pumps. So these are vacuum pumps that as you pull on the trigger, air comes up and you can get a vacuum effect. You can feel it sucking on my hand. These particular cups come in plastic. They're all different sizes for extra large areas. Large areas, you can see the opening. Medium and small. So there's a greater variety for different body parts. Even if you wanted to work a small area of the fingers, very small cupping tools. So the variety is lovely. This particular set also has a magnet embedded in it that as you apply the suction, which comes into this little button right here, attach, pull the trigger, you could probably hear the air sucking in, and as the skin is pulled up, you get a little tip of the magnet into an acupuncture point. So many acupuncturists like this for a little bit of magnetism to their acupuncture points. But say using it for someone who maybe has golfer's elbow or tennis elbow. You need to lubricate the area first with oil. I find lotion can work, but it's not as good as oil. And if you noticed, I didn't get it on my fingertips because I need those free of the oil so that I can manage holding the cup. If the cup becomes greasy, I'll often use a paper towel to give me a little bit of a better grip. But the silicone cups are wonderful for this. Patient is lubricated. You've made sure of certain things, such as the patient does not have a bleeding tendency. So how many patients are on all different kinds of blood thinners, anti-embolic medication, anti-thrombic medication, blood thinners. So check to make sure they don't have any contraindications, and always get medical clearance before using any of these tools. So that is your responsibility to do. So take the cup, soften it up a bit. I've lubed up the cup. I'm going to squeeze the air out, and as I place the cup, the air is trying to be pulled back in, and of course you have the balling up. If you just get a close-up of that, you can see how the skin is balled into the cup. One of the lovely things about these silicone massage tools, you can see through to see the response to the skin. So if someone is having problems with some of the flexors of the wrist and fingers, think about carpal tunnel, think about golfer's elbow, medial epicondylitis. I want to bring some blood flow in here. The fascias tend to get very tight from the fingers all the way up through the arm. So I want to loosen up those fascias, squeeze the air out of the cup, place it, and then follow the length of the muscle. I like to follow origin to insertion. So longitudinal stretch through the muscle. Notice we're pulling up the skin with it. So if the skin is tight, someone will say, hey, that's really pulling, that's smarts. It might even be painful for someone who's very, very tight in their skin. So if so, don't squeeze so hard before you put it on. Do maybe half a squeeze. Now you don't have as much suction. So it's a more gentle suction and a more gentle pull. When you reach an area of the body that might be hairy or dry, the cup tends to fall off. So you really want to play with the cup on yourself a little bit to get a sense of which way can I draw the cup. I like to work toward the heart, especially because that's the direction of the circulation. But you could follow right up into the muscles. Sometimes I'll leave it on there a moment or two to bring some blood flow into that origin of those finger and wrist flexors. You want to get down to the carpal tunnel, depending on the size of someone's arm. You get right into that area, loosen up, open up those flexor tendons. This is probably too big an instrument for that region. I might select a smaller cup, such as this one. Make sure to lubricate the area, because otherwise it just comes right off. Keep from getting it on your fingers and slipping. Place the plastic cup into the vacuum pump. Place that over the surface, and then you could just get it started. Sometimes the pin gets stuck inside, so you want to make sure you loosen that up if you're having any problem with the pin. If that's not freely mobile and you're wondering why the suction's not working, there's your answer. So let's try again. We'll troubleshoot. These are brand new cups. Now we can get some suction there, and once it's placed on there, you can then move it around and stretch. I can also do the suction and leave it on, but you just have to pop the vacuum off of the cup, and then I could go on and get some of my stretch. And this one is really, I got a lot of vacuum pressure here. This is really pulling. So you could work right into that area. Smaller cups may be beneficial to use over the palm of the hand. Play with the size of the patient, the size of their body part that you're working on, and select the cup that effectively fits. I'd like to show a little bit on someone's back, so we're just going to move across here now and see if we can get a little bit of good work to loosen up somebody's back with the cupping tool. So say the patient has been prepared. Here we have a seated massage chair, and if she has some tension up in the upper trapezius, levator region, upper scapula thoracic region, I have my cup lubricated. I actually have this patient pre-lubricated. Maybe do some massage first. You're ready for some myofascial stretching now. This is actually pulling the skin away from the body. You may be familiar with a myofascial release technique in which we do skin rolling. We lift the skin and roll it. Now here, she's tight here, probably because her arm's so protracted. So I want to lift the skin and roll it, and I'm having trouble lifting because it's too greasy. Well, the grease is there to help us with the cupping tool. And the cupping tool gives us an extra set of hands. Squeeze the air out, place, see that you have a nice ball of skin underneath, and now I can go ahead and massage into that area to that trigger point that we get right up there at that levator origin, coming down into the rhomboid middle trap, right across to the upper trap. And while I'm doing this, I could press in a little bit if I want a little bit more of a deep massage action, or I like some fascial release because the skin connects to all the tissues from superficial to deep, layer by layer. So as I start pulling, if you pull too hard, it comes off. I could pull, and now I could get some nice distraction of the fascia and loosen it up. You know, so much we're pushing on the body. This is a little different because you can then lift and pull and get a totally different type of massage. And you can see some of the pink of the blood flow coming to the surface. I especially like using these tools to work on the erector spinal muscles. Now if you have a little area of pink here, I'm going to avoid that, go around it. Especially in the low back, people are very, very tight at the lumbosacral junction here. So I might just slow it down. And I could even test from a fascial perspective. If I'm slowly moving and pulling up, do I feel more resistance? Or how is resistance when I'm lifting and pulling down? What about lateral versus medial? Where do I get the most resistance? So with this particular individual, more of the resistance is superior lateral. So I may want to make my strokes focus in that direction. That she has skin glide that's limited in a particular direction. It slides off, squeeze again, place. So if superior glide is limited, I'm going to focus more on the superior. If inferior glide is limited, I'm going to focus more on the inferior glide motion. And the same thing, medial to lateral. But people just love having a great massage with the suction cups. How does it feel for you?
Oh, it's wonderful.
What does it feel like?
It just feels like a little, well, sort of like massage, but more even. You know, it's soothing, and it feels as if it's helping any kind of tension that's there. And yeah, I really like it.
So I think about following the muscle structure, the muscle layers. So you think about your goals before you started the treatment. If it's a left quadratus lumborum, left lower back issue, it's tight, then I'm going to be focusing more on that area. If she has an exaggerated lumbar lordosis, you know how some people's backs curve in so much here, we call it an exaggerated lordosis. I could use this right over the spine because the skin gets sucked in with the rest of the postural issue down here. So I might work directly over the spine. I know many massage schools tell people, oh, you can't work over the spine, don't touch the spine. I don't know where that old wives' tale came from, but that is a misnomer. Again, of course, you check that people have no medical impairments that would contraindicate them using this. The biggest thing is the blood thinners or tendency for bleeding, or if the skin is not healthy. Now, some people have skin that's very easily broken. People who have diabetes, people who have poor circulation, very aged population with thinner skin. You don't want to be pulling on the skin something tough like a cup. I stick to more of my hands-on techniques for those people. But this is just wonderful. We have a patient here who is in the geriatric category, and she just loves using the cups. And I could work in any direction I want. You could do circular strokes. It's all a matter of playing with the cups, getting used to them, and thinking about what is the direction of tension that the patient has. Is the direction of tension, you get a stretch going up superiorly or down inferiorly. Now, where is the tension for her? And you could work out that area. If you miss an area because it's dry, just lube it up again and continue with your cups. And I've used these on the extremities, I use it on the spine. Patients just love it, and I also use it on myself. After the cupping, I like to just smooth out with some nice effleurage and finish my therapy. Let the patient know that there may be some coloration in the skin from the increase of blood flow, and that increased blood flow is normal. But unlike what you might have seen on our famous Olympian Michael Phelps, I didn't leave any bruises, and this is not one of my teenage athletes here. So you don't need to leave bruises or marks on the skin. Some people have issues with that, but certainly medical clearance and patients' informed consent that they understand that that is a possibility when using these techniques. So if you want to learn more about cupping, I have some fabulous seminars and workshops available. You could bring one right to your clinic and learn hands-on work. We also bring in the myofascial aspect of using the massage cupping tools, because this can save your hands. If you're working a lot with manual therapy, you want something that can help you have that good endurance to last for a long time. We need you out there doing great work. So check out my website, educise.com, educise.com. Check out the courses on myofascial release, and you'll see also some very exciting webinars on using these new massage cupping tools. I'm Teresa Schmidt, and thank you very much for watching. Enjoy.